Type of name and indication of the drug. The first type of drug is amiodarone. The brand's name of amiodarone is Bezeron, Cordarone, and Nextron. Indication of amiodarone is indicated for the treatment of ventricular arrhythmias, especially monomorphic VT, which is ventricular tachycardia, non-torsid polymorphic VT, which is secondary to myocardial ischemia and not associated with prolonged heart rate corrected QTC. Betanidine. The brand's name of betanidine is Batal and benzanidine. The indication of betanidine is for the treatment of hypertension. Drug is epinephrine. The brand's name of epinephrine is adrenaline. The indication of epinephrine is anaphylaxis. Emergency treatment of allergic reaction including anaphylaxis, which may result from insect stings or bites, foods, drugs, diagnostic testing substances, and other allergens, as well as idiopathic anaphylaxis or exercise-induced anaphylaxis. The third type of drug is metaldopa, and the brand's name is Eldomet. The indication of metaldopa is a medication used for high blood pressure. It is one of the preferred treatments for high blood pressure pregnant. Furthermore, the other types of drug is perindopril. The brand's name of perindopril is SN. The indication of perindopril is to treat hypertension, which is high blood pressure. The reducing of blood pressure will lower your risk of complication such as strokes or heart attack. Moreover is dapagliflozin. The brand's name of dapagliflozin is Cadura and Doxadura. The indication of dapagliflozin is for the treatment of hypertension to lower blood pressure. Lowering blood pressure reduces the risk of fatal and non-fatal cardiovascular events, primarily strokes and myocardial infarctions. Last but not least is doburamine. The brand's name of doburamine is Dobutrex and Inotrex. The indication of doburamine is indicated for patients who require positive inotropic supports in the treatment of cardiac decomposition due to depressed contractility resulting either from organic heart disease or from cardiac surgical procedures.
Doses PD3 and GD3. Intravenous for GD3 115 mg over the first 10 minutes. Its mean 15 mg per minute. Fourth is routes of administration from intravenous. Ventricular tachycardia. For adults, 14 mg every 5 minutes. Maximum total dose is 5 mg per kg. Second drug is epinephrine. First, acute asthma, 160 to 175 microgram. Means 1 until 2 inhalation. May repeat after 3 hours if necessary. Metildopa. Routes of administration is intravenous. Hypertension for adult is 250 until 500 mg 6 hours over 13 until 60 minutes as required. Fifth is perindopril. Routes of administration is oral. Hypertension adults as perindopril, albumin, doxorubicin. Routes of administration is oral. Hypertension for adults initially 1 mg at bedtime. dobutamine. Routes of administration is intravenous. Acute heart fluids, adults 2.5 until 5 microgram per kg per min.
Renal impairment and renal failure. First, metidopa. Adjust the frequency of dosing with renal disorder CRL 50 ml per min Q 8 hours. Peridompril. Concomitant use of peridompril tablets with product containing aldosterone is contraindicated in patients with renal impairment CGFR 60 ml per min. Epinephrine. 1 mg per 1 ml epinephrine acetylcysteine in a 2 ml single-use clear glass ampoule marked injection. Amiodarone. No dose adjustment is required. Doxazosine. The initiated dose of the doxazosine is 2 mg per day and is the threshold anti-blood pressure is normalized. Dobutamine 5 mg per min. Increase kidney perfusion and urine output. Betanidine. Patient with persistent renal insufficiency for mouth and throat only in instances of local irritation or sensitivity. Discontinue use.
Are also known as liver. First is amiodarone, and the dosage is for liver impairment adjustment is lower than 400 mg orally per day. And for the normal patient under the prescription is 800 to 1,600 mg orally per day for 1 to 3 and occasionally longer until a liquid arrhythmia control is adjustment. For epinephrine, the dosage liver impairment are not available. It appears that no dosage adjustment are needed. Third is metidopa. Metidopa is contraindicated in patients with acute hepatic disease, such as acute hepatitis, and acute cirrhosis. Next is pharmacology. Doses are doses for botulinum in hepatic impairment are not available. Next is pyrindopil. Pyrindopil, also known as active metabolite pyrindopil, but yet no dosage adjustment. Pyrindopil is required in cirrhotic patients. Dosing is the dosage of recommended dosing for dosing is appropriate for patients with clinically mild moderate hepatic impairment, but the dosage is not available. And dobutamine is also known as dosage adjustment in hepatic impairment are also not
Contraindication metidopa. Hepatic disorder. Visit patient on this said to be liver problem and decreased kidney function. Contraindication desirosine. Neglected concomitant use of PDE1 inhibitor with injectors is absolutely
Parkinson's disease, cardiovascular disease. Metadopa. The point is liver disease, dialysis, cerebrovascular disease, hemolytic anemia, leukopenia, peripheral edema, pheochromocytoma, physio. Betadine. The point is against bacteria, against fungal infection in oral. Pyridoprine. The point is angioedema, bone marrow suppression, hemodialysis, hyperkalemia, hypotension, liver disease, renal dysfunction, hepatic impairment. Doxazocine. The point is hypotension, liver disease, neutropenia. Dobutamine. The point is asthmatic, arrhythmias, hypotension, hypokalemia.
Next is side effect.
First is amiodarone. Amiodarone have an allergic reaction. The sign may include a rash, swallowing or breathing problem, swollen eyelids, face, lip, throat or tongue. 2 is epinephrine. Epinephrine, cardiac arrhythmia, irregular heartbeats, cardiac arrest. Third is metidopa. Metidopa inhale. Slow heart rate and low blood pressure causing dizziness on standing, water retention, causing swelling and weight gain. Metidopa in respiratory system, block or staphylococcus. Fourth is betadine. Betadine can get antihypertensive. 5 is perindopril. Concentration urine, dark in color, feel or sick, have muscle cramp, confusion and feet which may be due in inappropriate ADH, antidiuretic hormone secretion. Doxazocine is shortness of breath, difficulty breathing, common, may affect up to 1 in 10 people. Last but not least is the vitamin. The vitamin may increase heart rate, chest pain.